Dawson?
Here.
Dr. Lee?
Here.
Mr. Mayor?
Here.
Ms. Williams? And Ms. Mitchell?
Here.
Okay, so we have a quorum. We proceed to the next, which is going to be approval of two sets of minutes, one from November 29th and one from December the 30th. These were sent along with the package. So entertain a motion for.
We didn't have the December 30th meeting, right?
No, we didn't. We didn't. Well, what was
What's
that?
that, Shelton? Can you clarify that
It
for me?
was just an update on, for the RFQ.
That was on the 30th? Oh, yeah, it was. It was just a
Okay.
special meeting.
Yep. Yes.
Okay. Just to, I
You
just want to
have some
clarify.
minutes. You have some minutes. for-
Yes, sir. Yes, sir.
Okay. So we have two sets of minutes from meetings.
I'll make that motion.
Second.
We have a motion and a second. Any discussion, any opposition? Hearing none. The motion is approved. Public comment. So we welcome public comment. Any item that's up for a vote is up for public discussion. And we will allow time for that before the vote of those items. Reports on standing committees. Shelton?
All right. All right, well, thank you, Mr. Dawson. Thank you, commissioners, for having us this afternoon. So the first is going to be our financial review. As we look, net patient revenue was at 1.3. Total net patient revenues after our reductions to revenues of 308,000 came out to be 993,000. We have total operating revenue on non-operating, that's your Medicaid disproportionate share, was at 247,000, bringing us to total net patient operating is 1.2 million. When we fix the deductions as well as contract labor and salaries and wages, we had a net profit of $484,541. So that is our income statement. When we look at our balance sheet cash and cash equivalents was at 24.8 million. Total current assets is at 30. When you look at our fixed income with depreciation as well as our accounts payable and unearned revenue, total of 37.8 million. When you look at 11/30/2025, it was at 37.4 million, and from last year, which would be 2024, you had 37.2 million. That's an addition of 500,000, giving us the total of 37.8 million for month ending 12/31/2025. Turn over to the next page, and this is what I also gave to the audience. You have a high level. This is a high level dashboard, and this dashboard shows our total income. It shows this year, last year, the variance. It also shows our fiscal year to date of where we are with actuals on month to date and year to date. So we look back on patient revenue. At the top of your pages, you're going to see this year 1.3 million. Reductions to your revenue is at 308,000. Net patient revenue is at 993. Bringing down the net patient operating is at 484,000. Last year, because Mr. Dawson, you wanted to see what we did last year, was that this time was at 583,000. Your variance was at 99,000. But when you look at your fiscal year to date, this is where it tells the story. Patient revenue this year is at 4.3 million. Last year was at 4.1 million. Reduction to revenue was at 1.3. Last year was at 1.8. When you look at net patient profit at the bottom of your fiscal year to date, we're sitting at 2.6 million. Last year at this time, we was at 1.5. That is a variance of $1,128,000 over where we're at right now. Also, Mr. Dawson asked that we look at actuals versus budget. When we look at that, actual is at 1.3 million, We budgeted for 1.3, so slightly a little bit over, or a little bit under where we at. That's 22,000 under. When you look at your reductions, 308,000 versus your 564. Right here tells the story. We brought in $483,179 when we paid everything versus you budgeted for 77,000. That is a variance of 405,000 positive for the month of December. Year to date, Mr. Falcon, we had 2.6. We actually budgeted for 367,000. So that's going to give us 2,324,000 ahead of budget for this month. Currently where we're at.
How about sales tax? You have that on, what's the total on that?
I'm glad you asked me about the sales tax. I got you. If you look at the second line, Dr. Lee, you're going to see sales tax 159,515 for the month of December. When you look at last year, Mr. Dawson, you wanted to know what we did last year. Last year at this time, we had 224,973. So it was 65,000 less. But you look at fiscal year to date, we're at 728,000 versus last year of 399,000. So yeah, we had a slow month. However, year to date, we're trending in the right direction. And right now.
So is that December through January? Is that what?
Yes, sir. Yes, sir. Yes, sir.
Just one more time, if you don't mind. How much did we collect from December to January to that year?
Yes, sir. So when we look at, go to the next slide. This tells you. So a total of 2.1 million. And right now we're currently sitting at 577. So once we start to fill in the rest of the months, we are projected to be over 2.6 million for this year.
We had budgeted what?
We only budgeted for 2 million. Yes, sir. We'll go back a little, Mr. Donaldson. It tells our rolling 12-month patient revenue trends. I wanted to do something a little bit different for our board and for our community. This just shows the variance, and it shows exactly where we're at and where we're going. You can see our net patient revenue is still moving ahead. That is due to higher in our ER. You're going to see in our MEC, we had 535 patient visits for the month of December, as well as some of our invasive procedures with wound care is coming back. So that's good. That's showing that the net patient revenue is trending in the right direction. Also, Mr. Johnson, it shows the sales tax and investment income trends slightly higher, moving where we need to be. I also wanted to show the district the 12-month cash position. As you can see, we started having a slight decrease. And when you think about that, Dr. Levy, that is based upon when we went into our advisory agreement as well as our Epic Community Connect. So we have to trend down due to the budgeting for your advisory and for your Epic Community Connect. However, this time you do see we are adding, and that cash on hand is going back up to where we need to be. So that shows you your 12-month net patient receivables. So I want to attribute that to our billing team, as well as our HIM team, as well as our registration, because they are driving this and they are working those claims faster. Our claim rate is right around 6.5%, which is the average and where it needs to be. So everything is moving in a positive direction. And at this time, I'm open for any questions on our financials.
Well, I would just say, good job well done. We, what I see here is that, we're kind of steady on the cash flow, kind of steady on the income coming in and the net income. And, I think that's it misses the true picture, which is, it's done that with all the improvements that have been made here at the hospital. And I think that, our healthcare, the people that are coming in for our healthcare services, they're seeing the difference. We know that. We get that feedback. And if we can keep that net income close to being steady, then good job.
Yes, sir. Yes, sir. Yes, sir. Mr. Mayor?
I don't have any questions.
Mitchell?
Questions?
Dr. Levy?
I just wanted to know, what's your next focus? Like, what are you focusing on now?
So our focus at this moment, Mr. Dawson, now we had a conversation today on Epic. And
Okay.
Epic is taking a lot of our time. However, we know that with Epic, it opens up for, an additional world, a world that we haven't tapped into. So when we look at our patient revenue, we're going to be able to capture patients that may be leaving our market. Maybe these patients can be able to stay within our organization. And that better flow, that better accounting process through Epic is where we are focused on right now. So making sure that we have a new clearinghouse. So I'm working with our clearinghouse vendors to making sure that we have everything that's what's needed. Then we look at on our coding side, and we look at where we are with our billing and making sure that all of those billing practices are in place and that the staff are working it each and every day. So we are focused now on making sure that we have a smooth Epic implementation, but also we're looking at the future. We're looking at what our outpatient clinics and our outpatient service lines can bring to our bottom line. Because we want to continue to improve on our bottom line, but that means that we need to work more with our wound care department. That means there's more that we have to work with our cardiology department. That also means that we have to look at other partnerships, whether that's with FMOL or whomever, to make sure that we are strengthening and we're bringing the best possible services for our community and our organization. I'm proud that we have a new CMO, and I'm going to introduce him to the board shortly. But having that opportunity to have a new CMO is going to be able to bring a different form of revenue for the hospital, and that's going to help us all out.
What's CMO?
So we have a new chief medical officer. Yes, ma'am. And I'm going to introduce. I can introduce him right now. Our chief medical officer, Dr. Mike Blanchard. Dr. Blanchard. Doc, you want to tell them a little bit of?
Sure. My name is Mike Blanchard, born and raised in Louisiana, from Baton Rouge. LSU undergrad, LSU med school, went off to Vanderbilt for residency, and Iowa for fellowship. Practiced in the orthopedic clinic for about 20 years. Retired from clinical practice about a little over a year ago. Happened to meet Mr. Anthony at a Rotary Club function, and we started talking, and next thing you know, here I am. So, I'm very grateful for the opportunity and hope to do all I can to help this place grow our outpatient services, help with clinical decisions, and provide better service for the community.
Thank you. Welcome.
Thank you.
Welcome. And thank you. Look, we know it's kind of almost volunteer work that you're doing for us. And even though I'm gonna kid with you every once in a while, we definitely appreciate. And then, you got any friends or good, other good doctors telling me you found a
Tell
good
them you haven't
place over
called.
here.
Mr. Dawson, that concludes my financial report. And now I'll move into our MedExec and our quality report. Overall quality and compliance remained strong for the month of December. We had 0 denials, 0 physician and quality issues. I had no incomplete charts. Medicare, Medicaid was flat. Our emergency department volumes was stable. And like I mentioned, Dr. Levy, we saw 563 patients. That is the highest number of patients that we have seen year to date, right, in San Jose? And I cannot stress the level of importance and gratitude that we have for our clinical staff here, as well as our community. They're trusting in what we are doing here, so that means a lot. We had 1 admission, 6 observations, 45 transfers to higher level of care, 11 AMAs, and 25 within our 72-hour return. So that's trending in the right direction. Basically, we had some social services report. We had 2 grief counseling. We was able to serve on our West Side Christmas events breakfast with Dr. Buggage, as well as Dr. Lewis, 100 participants at Lowry Elementary and 85 at Lowry Middle. The Christmas event with the LeBlanc Special Services was with 110 participants. We had our OCES report. That's with breast cancer awareness. We had 89 participants. and her outpatient follow-ups was at 5. Basically, our MEC with Dr. Blanchard met on January 20th. Like I said, we had 0 Medicaid admits and 0 denials, which is all good. And Dr. Lewis, Dr. Levy, I'm sorry. As you can see, we're moving to 0 harm. And I know that's been where we have wanted to go the last year, is 0 harm and 0 adverse reactions. And that's where we're headed at this time. QA review, I just told you, you had your 6 on your observation, wound care total for 20 patients, 0 specimens for my ER that was received, as well as your pathology review was at 0. Ultrasound was still flat, and that was due to we had some ultrasound tech scenarios. X-ray exams at 120, CT is at 80. And Ms. Tanya, I know you'd like to know about our compliance on our nursing documentation. Was at 99%. We had 20 records that were reviewed, and Ms. Janey said all of the records looked appropriate at this time. Looking over our flu A and B, Mr. Dawson, we ordered 222. We had 84 that was positive. On our strep A, we had ordered 180 with 3 positive. RSV was at 37, 2 was only positive, and COVID-19 was at 236, and 1 was positive. I will say Ms. Anastasia and her team worked tirelessly with our respiratory department because we had a lot of flu that came in for the month of December, and she saw a lot of flu for January as well. But we was glad that we was able to take care of those patients here.
So the admits to the ER, the 560, that was that actual month, December?
Yes, sir. Yes, sir. Yes, sir. That was actually.
What do you see on usually December? I would think you'd see less.
Oh, we see a lot of flu
Okay,
during December.
okay.
A lot of respiratory.
How many were like revisits, like
How many what?
revisited, like
Oh, what you said it was?
the same symptoms?
I got it right here for you, Doc.
Normally our revisits is more of the behavior, like mental and behavior. That's what we normally see repeating most of the time.
So we had 25 that returned within 72 hours. I can tell you this, we joked and we laughed. I have a patient who loves to come and see me. Come see me. I love my patients. I love that they trust us to take care and provide them that care. All right. Total ABGs, Mr. Dawson was at 9, 115 on our EKGs, and your oxygen hours were flat right at 384 hours. Mr. Bro, you have anything to say on the respiratory report?
Just use a lot of oxygen on those patients that can pneumonia or respiratory.
He asked me for a lot of money for those oxygen. That's really what it is. But Mr. Bro, you have hired a respiratory director, right?
I'm retiring from respiratory department again. And this year, we have another director of respiratory. Her name is Lakia Phillips. She is coming to us with over 20 years experience. She has 1 master's degree in health administration, and she's obtaining her 2nd master's degree in May in public administration. We're good to proud to have her.
So you leaving or you
No,
staying?
not leaving.
Good,
I'm on the
okay.
other side.
All right, next, Mr. Dawson, is our environmental care plans. Still continuing is our generator load test with our 40 kW as well as our 300 kW. We did, the last 2 weeks, had our standalone 40 kW from the parish that we had here, just in case we was to lose power during the ice and winter system that we had last week. But we did not have to use that. Your safety and risk management plan is ongoing. No activities for continual monitoring. Utilities management, as well as our line isolation and med gas, was all completed. Fire extinguisher inspection was ongoing. We are waiting for the fire marshal to do a revisit, but our oxygen cutoff valve, ground fault testing, and our hazmat and waste management plans have been ongoing and where it needs to be. And continuous monitoring is where we need security, no problems on there. I will let Mr. Bro introduce Mr. Derek Edmonds. Mr. Edmonds and his organization is working on some strategies for our floor care for the overall.
We're looking to improve, the quality of our facility look and the cleanliness of it. And we hired Mr. Derek, he can tell you about his name of his company and what they're about.
Yes. Good afternoon, everybody. Thanks for allowing me to be here. My name is Derek Edmonds, with Edmonds Enterprise, LLC, and Quality Housekeeping Solutions. As James and Shelton mentioned, we just partnered with the hospital to reinvigorate the floors here. We've been here for about 2 weeks now. Got 4 of the halls done, 16 rooms. So we'll be making our way around the whole hospital, taking care of your VCT tile, your layout flooring, cleaning those things up, and really trying to reinvigorate the place for you guys. It's been a lovely experience so far. Everybody's been nice and helpful to myself and to the team. So we're really excited about this partnership and just look forward to continuing. So.
Thank you.
Thank you.
A little bit about our cyber report in past 30 days. 1,644 exchange messages were quarantined and recognized as phishing scams. So that's kind of up. Our email activity is up by 26% for the last 30 days. We have been working with our Epic team and the FMOL team to ensure that our operations are fully functioning as needed. Your lab Microsoft Workstation production test is full restored, and that's all working properly. And Mr. Dawson, this now concludes my financial report as well as my MEC and quality report for the month.
Okay, so we have under new business, you
Can I get a
can sit
motion?
down if you want.
Oh,
I'm trying to get back up.
Can I get a motion, Mr. Falcon, to approve the financials as well as the quality and MEC?
Take them as presented. I'll make that motion.
Make a motion. We got a motion and a second. Any discussion? Any opposition? Motion passes.
All right, well, thank you, Mr. Dawson. Now we move into our new business, and I could sit down for these, can I? However, we're gonna go into our application for review and approval of temporary as well as full privileges. First is Dr. Joshua Bacon. Dr. Bacon comes to us from Blue Angels. That is our ER and our hospitalist group for full privileges. Dr. Bacon has been before quality as well as MEC. And with the recommendations from MEC, we're seeking full privileges at this board meeting.
We need a motion for that.
Yes, sir.
So moved.
Got a motion and a second. Any discussion? Any opposition? Motion passes.
Next, Mr. Dawson, we have one of our very own, has worked with us in our emergency department, as well as on our inpatient side. She was one of our registered nurses, one of our charge nurses. She went back to school, and she became a nurse practitioner. So we are glad to have her. Ms. Anastasia, I'll let you do her recommendations.
Ms. Trinice Sanders, NP, we asking for full privileges.
Is she here tonight?
She's working tonight.
She's working. She's working tonight.
Well, tell her thank you.
We're gonna send her a text and tell her just if she have a moment to pop over here and while we having our meeting. I just want to introduce y'all to Ms. Trinice. So Trinice is gonna be working with Ms. Anastasia on one of our newer outpatient service lines. So we are very fortunate. We were very glad that we are continuing to grow. So to be able to have one of our very own and to be able to move her into a nurse practitioner role, I'm thrilled and I have a lot of joy and I love it. So Ms. Anastasia?
She's our first to be
nurse.
hired, yeah. By the hospital.
And that means a lot to y'all. You know, Ms. Tanya, you and I, we spoke about quality staff and we spoke about, having our own staff here that our community can be proud of. So Ms. Trinice is the first that we are seeking full privileges for.
We need a motion for her to have privileges as a nurse practitioner.
So moved.
Already second.
All right. The next is Dr. Next, Dr. Vivi.
Motion passes.
Motion passed. Next, Dr. Jaber. Dr. Jaber is with Tulane Telestroke, and Dr. Jaber has been before quality as well as our MEC. And tonight, I'm asking for full privileges for Dr. Jaber for Telestroke with Tulane.
So moved.
Got a motion and a second?
Second.
Any discussion, any opposition? Motion passes.
Right, and that was Dr. Blanchard's first MEC that he had to approve some providers. All right, so the next board, I just want to bring before a young lady who has come into our organization. We hired her several months ago, and she has been wonderful. She has taken over our education department, and she has really, I could say she's been a pain in my side, but I'm not going to do it like that. I'm going to tell you that she has been an asset, and she is an asset and a valued employee. So, Ms. Williams? All right.
Put on the side.
Hi, my name is Tarnika Williams. I am a registered nurse by profession. I've been in healthcare my entire life. Started with dental, moved to respiratory, and I went back to school for nursing. Mr. Shelton asked me to do a high-level training for basic, what do we need this for?
So this is for our basic annual competencies for our Board of Commissioners. So this goes over our compliance, it goes over our governance, it goes over sexual harassment, it goes over HIPAA, and it goes over our ethics. So we're gonna make sure we have this in the minutes so that we can have this in accordance for CMS as well as LDH, and then you could be able to go online to do your validation. So she's gonna have a very high level and then.
Very high level. I'm told I have 10 minutes. So I am gonna run track through this if that's okay. All right? So we have the board annual compliance and education. This is something that we're gonna do annually. In your packets, let me describe what's in the packets first. So I have a copy of your PowerPoint, and then there is some paperwork that we just need you to sign and to date that we're going through this on a high level perspective, if that's okay. And if you have any questions about that after, I'll be here to answer any question. I have 10 minutes. I think I've used about 30 seconds, so let's move on. All right, so governmental ethics. Governmental ethics ensures that individuals serving in public roles act with integrity, transparency, and accountability while serving the public interest. Examples is, voting privileges, not leaning towards, say Anastasia is my friend, I'm gonna go ahead and vote because I like Anastasia, but not exactly what she stands for. So, HIPAA. So HIPAA is Health Insurance Probability and Accountability Act, and it protects the privacy and security of patient health information. This is important, especially in this community. Oh, that's Trinice. It's important, especially in this community, because we're so home, everyone is family, right? And so we want to talk about our cousins that is in the ER. We can't do that. So we have to respect our family's information, all right? So fraud and abuse prevents, protects healthcare resources, ensures regulatory compliance, supports ethical operations within WAPH. All right, LDH, that's the Louisiana Department of Health. Louisiana, the LDH compliance refers to adherence to state laws, regulatory standards that govern the operation of health facilities to ensure patient safety, quality of care, and regulatory readiness. Example of that is supporting corrective actions after surveys, which we are big on. The board role, so we're gonna talk about the board role and compliance. The board's role in compliance is to provide oversight, accountability, support to ensure the organization's operations in accordance with applicable laws, regulations, and accreditations and standards. QAPI. QAPI is quality improvement, standards for quality assessment and performance. It is a structured ongoing process used by healthcare organizations to monitor performance improvement, quality, and enhance patient safety using data-driven methods. So we see what works, we see what doesn't work, and we try to correct those things. Sexual harassment. Sexual harassment refers to unwelcome conduct of sexual nature that creates an intimidating, hostile, offensive environment. This includes verbal, nonverbal, visual, or physical behaviors. We have zero tolerance for that. Professional conduct is required. Examples, inappropriate comments, is one of the things that is frowned upon. So harassment and incivility refers to inappropriate, disrespectful, unprofessional behavior that interferes with a safe, respectful, and productive environment. These behaviors may be verbal, nonverbal, or behaviors not limited to conduct of sexual nature. So, I mean, it could be a joke, you know, anything that we think is just not harmful, but may be harmful. So the board sets the tone for the culture, and we are to fall under you guys' standards. Lastly, this is annual acknowledgement. This education review will be annual. It requires that we read what we're going, the overview, sign it, and it will be supported for our requirements. In addition to this, we will have sexual harassment link sent by, I think it's on LA Gov Learning. Mr. James sends out the Louisiana Board of Ethics, but we have have to contact before we start the sexual harassment. So you guys, please be looking out for these. And again, I'll be here if you have any questions. Sorry I had to run track, but I had 10 minutes.
Question.
Yes.
So this is in addition to the ethics training?
Yes, ma'am.
So you want us to thoroughly read this part, sign it, and give it to you, and then do the ethics training and send the certificate?
In addition.
And then you have the sexually harassment link you're gonna send to us to do like another training?
Correct.
Gotcha.
I'm so sorry, but it's what they require. Yeah.
So there's two added pieces. It's not just the ethics training with the certificate anymore. It's
correct.
If it's something similar to what I do.
Section, yes.
Yeah, you see.
Y'all do for teachers, I think.
Yeah, but this is like a just.
I think some of you have already done the ethics. I think it was 2.
Ethics I've already sent to James.
And yes, you guys have already completed that portion.
Okay, yeah.
I want to bring up. Yes, now we just after some privileges and everything you want to just.
He's so proud of his homegrown talent. He wanted to.
Dawson, Dr. Levy. I want to introduce Ms. Trinice Sanders, our first nurse practitioner. Trinice.
Know most of everybody. So I was born and raised in Dawsonville. I worked previously here, with the first administration, then, I recently came back, and I've been here since. So I'm very excited. I was born at the hospital also, so I think. Since June of last year, but I previously worked here for like several years.
Okay, I didn't know you were in fact. Well, welcome back home.
I'm excited to have mental health here full time. So I'm just excited.
Yeah. Thank you.
But
Thank you.
I'm sorry, you guys, but I'm rushed. I have a meeting to go to too as well. My rep meeting.
All right. Well, thank you so much.
Thank you.
So this is also on this. This is our resolution on the Louisiana Compliance Questionnaire Review. This is annual that we have a resolution. Ms. Austin, do they have a resolution?
Tell what is this? What
This is the Louisiana
resolution?
So this is the Louisiana Compliance Questionnaire. So this is what we have to fill out every year as a board. This is for the audit.
Don't need a resolution. Do we need a resolution?
Yes, sir. Yes, sir. We have to do it. And I have the resolution already drafted.
Oh, this is the resolution.
Yes, sir. Yes, sir. The resolution is there. That's for the audit. This is what we sign every year. Yeah, we sign this every year.
Sign it for each individual board member sign it, or the board needs to just approve this?
The board needs to approve it, and then you and Dr. Levy sign it like we did last year.
Right, Carl?
All right,
So basically, that's, oh, I thought that's something.
all right. So we'll entertain a motion for this resolution, Louisiana Compliance Questionnaire.
So moved.
Got a motion?
Second.
And a second. Any discussion? Any opposition? Here, none. That motion passes. So we'll sign this, Dr. Levy, sometime. I guess now, maybe.
Next on our new business, and I'm almost done, is our Epic implementation review. Basically, I want to go over that our Epic Community Connect, this is just a high-level snapshot. We are on track, so everything's in the green. Implementation of our Epic Community Connect. Our go live, I pushed our go live back to September 1st. This is to align with our fiscal year, because fiscal year starts 9/1. Instead of moving from July 14th, which would have kept us with Athena as well as Epic, we want to do a clean financial start. So that's the reason for our go live. Current progress, clinical workflows with inpatient, outpatient is being built. Lab, radiology, pharmacy, and wound care is ongoing. The charge master is being built at this time. We have worked with our legacy Athena to make sure that all of our historical data is captured. Nuance magnification is in progress. On the rev side, Impact is going to continue doing our billing. Sample bills and reports are under validation. Early out and collections are being pending. And on our security, we do have our role base that are assigned and underway. We are starting to identify super users as well as credentialed users. Role-based training program and training center is being developed here at the hospital. We've also secured CorePoint, which is going to be our interface engine. And this is going to make sure that all of our goes for the hospital, for our orders, the results, as well as interoperability is being completed. The bottom line, the project remains on schedule. It's well governed and positioned for a successful go live. I will tell you that Epic is an additional department, and it feels like I have 50 new employees. And we are on calls, all day, every day. But the team and the leadership is working tirelessly to make sure that everything is being done. So we're moving ahead on Epic.
What is the schedule for complete implementation?
September 1st.
September 1st.
September 1st. So it's right around the corner. Right around the corner. We're moving. All right. Next, I'm glad that we have Mr. Gasper here. And Mr. Gasper and I worked on our RFQ. And Mr. Gasper, you want to say anything about your RFQ?
Yeah, the second of our 5 postings of our advertisement for architectural services was today in the parish's official journal. On February 16th is the deadline for architects or prospective architects to submit questions to us. We have 4 days we respond to those questions if there are any by February 20th. The deadline for submittal of qualifications, or statements of qualifications, is March 4th. At that time, I'll get copies of that. Mr. Dawson or the board will get copies of that. The board, in this case, is the selection committee, right? You're not gonna, so you're gonna have it. I can assist with that, but that's up to you.
Legal, that's what I'd like to do. I don't know if the board wants to. I don't see going to the parish and grabbing somebody else.
Yeah, I trust us.
Yeah.
I'm qualified and happy to do that if you wish to do that. At a point short list, let's say we get 6 or 7 or 8 architects submitting SOQs. Not impossible for a project of this size and nature. We will go through those SOQs. We will shortlist those. I'll give everyone a grading sheet, and you'll go through and look at the SOQs and grade those SOQs. Then we'll compile the results. We can meet, we can discuss those. We can do the reviews independently, but then we can meet and discuss the reviews. And you'll shortlist from those discussions, let's say 3 architects, and conduct, at your discretion, conduct oral interviews with those architects. You're not required to do that. This is a professional services selection. It's not like a low bid thing or anything like that. It's subjective on your part. It's more or less subjective. It's not completely objective like when you get a bid on something.
So do we have a date for the selection to be made?
I think we have a tentative schedule. So I'm not remember what the date is, but we got to give ourselves some time. If they're due on March 4th, you got to give yourself some time to review these. They're going to be thick and a lot of them. So it's going to be, if you want to do a good job, you want to really go through those. And what I'll do is I'll give you things to look at. And when we put the RFQ together, we specified what needed to be in that RFQ. And really, we're going to be checking the RFQ against that. And an RFQ, an SOQ that's well done will line up with those requirements that we put. So you'll be able to give your impression. And what you're going to do is, it's a relative thing. You're going to be comparing to each other, comparing them to each other.
So let me ask, Mr. Dupatti, do these meetings that we have as a committee, do they have to be noticed and open, or?
Yes.
If we all meet, the ones that we come in and discuss, probably so, right?
Yes. Yeah, you're gonna be reviewing them independently.
In a public, yeah, and then.
When you get together to compare notes.
It'll be at the
There's
public.
another option, and we can discuss this. You can give me your feedback.
Okay.
Independently, and I can review those and compile the gradings, let's say, and then present that to the board. And then based upon that, perhaps we would, if you wish to do so, we can organize oral interviews. We give the architects that are shortlisted 10 days or so, or 2 weeks to prepare for an oral interview. That sort of thing. But we can discuss those details. That's where we are right now.
Okay.
Any questions?
Questions, thank you.
Okay.
Mr. Dawson.
Okay, so we have
I do have one question. Do we have any yet? How many do we have yet?
Well, I don't think any of it's, they're gonna be sort of last minute.
That's how it goes? Okay, all right.
Like with everything.
It's quite a lot to put together, although
Yeah.
these architects they do it all the time. So
Yeah.
they're gonna be they're gonna looking at the details of the RFQ and put their SOP together based.
Right.
Takes
I
a
was
little bit of
I
time.
was just curious.
Okay, so we have Dr. Levy, you want to do that? This is the introduction for the ordinance to ask for annexation into the city of Donaldsonville.
Yes, do I have to make a motion?
Just make a motion, doesn't have to be seconded or anything else, and then it'll just be, this is the introduction to take it up at the next meeting.
Okay, so I'll make a motion to discuss, annexation of the West Ascension Parish Hospital into the city of Donaldsonville limits.
Yeah, not really discussion, it's just introduction
Okay.
for the next meeting.
For the next meeting.
All right. And then the last item that we have on the agenda is the election of officers. We have to be elected chairman, vice chairman, secretary, treasurer. And guess does everybody, Dr. Levy is the secretary. Falcon. So. Okay, so there's two, we can take each one of these offices up individually, or you could adopt the whole slate for another year. It's up to you guys.
Can we just adopt the whole slate?
All right,
You
yeah.
make a motion to
I
adopt
was,
the
yeah,
slate.
if y'all
I make
want
a
to do
motion
that,
to
that's
adopt the
fine.
whole, all
And
four.
you second in that?
Yes.
Okay, so let's make sure that we have that. That would be myself as chairman, Falcon as vice chairman,
Yes.
Dr. Levy as treasurer, and
And Shelton.
Shelton as the secretary.
Yes.
Which is, that's also spelled out in the law about that.
Yeah.
So, okay, so that's we have a motion and a second. Let's do a voice vote on that, Austin. Voice vote on it.
First officer position to be elected is chairman. Are there any?
No, just, all you need to do is ask, are they in favor of the motion or not? Because there's
Yes or
already
no
been a
vote.
motion to adopt this as a slate.
Yes or no vote?
Mr. Dawson?
Yes.
Yeah.
Dr. Levy?
Yes.
Mr. Muir?
Yes.
Ms. Mitchell?
Yes.
Carries.
Okay, thank you. Saved us again.
I got you.
All right, that's it for me. Now we have the executive session. So entertain a motion to go into executive session.
So moved.
Second.
A motion, a second, another voice vote. Say aye if you're in favor.
Dr. Levy?
Aye.
Yes.
Yes.
And Ms. Mitchell?
Okay, motion carries unanimously.
Bill, do you want me to stay till you get?
You don't need to, I mean, you're welcome to, but you don't.
Yeah, let's get together and talk about it.
Yeah, yeah, I like that.